Hi, I'm David Santo, a summer fellow at the BD2K Links DCIC program at the Mayan Lab, and I'm here to talk about my age prediction project. The inspiration for this project came from a paper published by the Mayan Lab in 2017, which described the creation of a deep learning model that could calculate someone's physiological age by predicting their age based on their lab tests and vital signs. On average, the physiological age calculated was within 7 years of real age, and the model computed this by using 1,573 parameters from Mount Sinai's electronic medical records. My goal was to miniaturize this model and deploy it for consumer use, so the first thing I did was recreate the model described in the paper so I could get a better feel for the deep learning framework it used. So why do we care about physiological age? His research analyzed the 380,000 patients whose data was recorded and found that for those with a large discrepancy between predicted and chronological age, the group with a much older chronological age was more likely to have increased health risks, such as higher systolic blood pressure, cholesterol, and a damaged liver. And those with a much younger physiological age than true age appeared to experience health benefits from a much better regulated system. Most importantly, the difference between physiological age and chronological age appears to be a good metric for overall health. However, the everyday person wouldn't know 1,573 things about themselves, and even if they did, it's impractical to expect them to have the time to put all of them in, when most of them don't even contribute significantly to the age calculation. My first job was to figure out how many parameters the user should be able to input. There's a big trade-off between convenience and accuracy, and I wanted to figure out the ballpark estimates for accuracy depending on the number of parameters. My first iteration selected parameters based on the most commonly measured ones, such as height, weight, blood pressure, and pulse. I then ran a machine learning algorithm for the top 10 parameters and checked its accuracy. Then I ran it again for the top 20 parameters and checked its accuracy, and then 30, 40, and so on until 100. The results indicated that for 10 variables, it determines true age on average within 12 years, and it drastically drops down to about 9.6 for 20, and from there it slowly and asymptotically decreases as more variables are added. I decided to use 20 parameters for the final model since it's a really doable number for attributes of the user to enter, and the trade-off between accuracy and convenience was pretty good. More importantly, I would be improving the accuracy in the coming days and weeks for only 20 variables. As shown in the slide before, the attributes with the most occurrences did an okay job predicting age, but it could be improved. I did two methods of statistical analysis in order to determine variables which are the most predictive of age. Multivariate regression, while only showing a linear relationship between each parameter and age, was a computationally simple method and yielded great results, initially knocking down the age prediction down to an error of 9.2 years. Mutual information, an algorithm that can predict quadratic, cubic, and other relationships, didn't seem to perform as well, so we ended up going with the results from the multivariate regression test. After I finished my first round of analysis, I performed robustness tests on each variable in order to determine that each one was significantly contributing towards the model. This is an example of a robustness test. I systematically removed an individual variable out of the 20 total ones, and then I ran the model to check its accuracy. Then I subtracted the accuracy of the 20 variables from the accuracy of the 19 variable model in order to determine an individual variable's contribution. For example, when systolic blood pressure was removed, the model was less accurate by 0.67 years, indicating that it's a significant variable to keep. However, when another measurement like mean platelet volume was removed, the model actually performed better, shown by the negative value, and could be replaced by another, more indicative variable. I repeated this process until I was satisfied with each variable and their contributions. This is the final set of features I determined with a much lower error, and my next job was developing an interface for the end user to input all their data. The application, dubbed PALM2A for physical and laboratory measurements to age, is developed to be a web and mobile application and is also accessible on the App Store and Google Play Store. This is the final interface for the project. The model has failsafes to ensure that accurate measurements are input. For example, if I put that I have a weight of 6,000 pounds and try to submit it, it'll highlight the field and let me know that the value is too extreme. It can also switch to metric measurements upon clicking of the metric button for all of our friends outside America, and you may notice that the height switches to be in centimeters, weight becomes in kilograms, and temperature becomes in Celsius. Lastly, if the model is submitted when it has fewer than 15 parameters, it will not calculate age in order to maintain accuracy of the program. If more than 15 parameters are entered, the program will guess the missing parameters and the age is then calculated with those values. At the bottom, you may input a sample person and view their results. Let's try that. On the results page, you can see how each of your inputs compare to the general population. On the graphs on the left-hand side, they show that you're the dotted line, and the area indicated by the blue and green bars captures 70% of the male and female population respectively. Along with age prediction, the usage for PALM2A comes from its ability to compare measurements. For example, for GFR, a metric of kidney filtration function, it's shown that for a 60-year-old, our reading might be a normal reading, but if the user happened to be 30, our measurement might be a cause for concern. The graphs on the right also show a probability density function, and from there you can also see how your results compare to a population distribution. Future work may include a health report for patients based on their input data, and it would let them know if any value is outside of the normal ranges, along with any suggestions to improve it. Other machine learning models could also be developed based on the electronic medical records in order to alert patients for any at-risk conditions. Lastly, if all patient data is already stored in a Mount Sinai database, the program, in the future, could easily interface with it and autofill in vital signs and lab tests by the click of a button. I want to say a big thank you to my direct supervisor, Zichen Wang, and to my PI, Avi Mayan, for helping me develop this program. It wouldn't have been possible without their expertise and mentorship skills. Also, thank you to Sherry Jenkins for organizing such an amazing program. Lastly, thank you to the rest of the lab for their unending support, making for such a great summer.